Good morning, everyone. It's lovely to be with so many governance devotees today, even if it is only virtually. My name is Lois Howell, and I'm Director of Governance and Risk at the Isle of Wight NHS Trust. For those of you who don't know it, the Isle of Wight Trust is the only completely integrated trust in the country. We provide acute and ambulance and community and mental health services. And that means that at every board meeting, at every quality committee meeting, every audit committee meeting, etc., we're trying to squeeze everything that those four different types of trusts should be covering onto one agenda. It's a lot to do, and that's why I love a well-crafted checklist or a clear, accessible set of guidance. And consequently, why I'm very pleased to be here today to chair a panel that will talk about the proposed new Code of Governance due to be published in draft for consultation purposes shortly. We're joined today by three august commentators who could loosely be described as a promoter of the new code, as a regular user of the code, and as an advisor on the code. We have Miranda Carter, who's Director of Provider Development at NHS EI, Paul Howard, Director of Corporate Affairs at Wrightington, Wigan and Leigh Teaching Hospitals NHS Foundation Trust, and Claire Leigh at Charis Consultants. I will ask them all to introduce themselves and present their views in a minute, and then we'll be inviting questions on the chat facility that hopefully everybody is now familiar with. But firstly, let's remind ourselves that the code was last updated in 2014. That's so long ago. It was produced by Monitor, blast from the past. And a week may be a long time in politics, but 8 years is at the very least an era in the world of the NHS. In 2014, we were all just settling into the last version of the new world, as introduced by the Health and Social Care Act 2012, and we all still thought that CCGs were the latest hip and cool new thing. So clearly an updated version of the code is absolutely due. Some people might perhaps think that the updated version is in fact overdue, but there is undoubtedly a lot of change underway at the moment that an earlier vision would have been unable to accommodate. It's always previously been the NHS Foundation Trust Code of Governance, but it's proposed for updating as an inclusive document, explicitly available to or applicable to all NHS provider trusts. This change is an important reflection of the national shift away from focusing on the pursuit and maintenance of FT authorisation and onto the delivery of the NHS plan in partnership and collaboration with a wide range of NHS and other organisations, some of which are covered by this code and some of which are not. The code reminds all NHS provider trusts that a key purpose of their existence is fulfilment of the triple aim duty: better health and well-being for everyone, better quality of health services for all individuals, and sustainable use of NHS resources. So let's see what our panel members have to say about how the new code might help us achieve that. Thank you. Miranda, can I hand over to you, please?
Thank you very much, Lois. Great introduction to the update of the Code of Governance. And I don't know if many people know me, but I have been around since the very beginning of Monitor. So I felt very proud about the first version of the FT Code of Governance. And I guess equally happy today that we've got to a point where we can give a further update to the Code of Governance, which can be helpful to both Foundation Trusts and NHS Trusts as they lead and run their organisations to deliver high quality, effective care. So I do see it as a very important document. And Lois, as you said, it's been an awfully long time since we updated it. And I remember having a conversation with John Coots about when are we going to update it, but there has been so much change. I think it is actually helpful that we're doing it now to bring in and align it with system working and the update to both the UK Corporate Governance Code. So just in summary, I think the things that have changed, we've moved away from independent foundation trusts much more towards integrated system working, which I really support, and the need for collaboration to deliver the triple aim. We've got the Health and Care Act 2022, royal assent has just been given. And I said earlier, the private sector corporate code has also been updated by the Financial Reporting Council, I think effective from 2019. And we just more generally, as a policy point of view within NHS England and Improvement, want to align the way we treat trusts and foundation trusts. So ripe for updating and improving the code. So let me talk to you a little bit about the key features of how I think it's changed. So I think it's not a fundamental change. It's still best practice in corporate governance designed to help company secretaries and boards run and lead their direct organisations effectively. We always in the past mirrored and then adapted where appropriate the private sector code. So I think that principle still applies. Certainly the private sector code has been updated to be more principle focused, but interestingly with a greater focus on the need for wider relationship and responsibilities to society. And I think that really reflects what we're trying to do within system working and the triple aim within systems. So I think we really are aligning going forward. It still will continue the comply or explain approach, so does allow flexibility, so sets out some clear guidance, but does allow for things to be different and to report on those differences, which I think is important, because there are nuances in many different organisations, but the principles will apply. I've talked about it aligning, so the code will make clear that it applies to both trusts and foundation trusts, and then also updated for best practice in terms of appointments and remuneration and pay has come into the code. I think the other bits that I've picked out, there is a clear reflection on the triple aim, certainly at the beginning of the code, and the need to work collaboratively to help deliver better health and well-being to society, better quality of care and sustainable use of resources. So that's clearly mentioned in the code, and I guess reflects that wider contribution to society that I mentioned earlier. We talk about diversity in the code, so right at the very beginning we talk about a trust led by effective, diverse and entrepreneurial board. We talk about culture within the guide, so boards should assess and monitor culture, and the annual report should explain their approach to rewarding and promoting the well-being of staff. So I think in terms of everything we are trying to do within the NHS and the focus on well-being of staff and the importance of a good culture, that will also come through in the code. And when you look later in the code, it talks about the diversity within the board. So I think those are the key changes, and we hope that will, obviously the nomenclature will change, that we don't have references to monitor and things like that. But those are the key changes. So what's next? So this is one part of some documentation that we're releasing from my team, which is traditionally focused on providers, to help address that sort of perceived tension between, your own autonomy as an organisation and sovereignty versus system working. So we've updated the code to reflect the importance of system working and how that can be reconciled with your duties as a board. But there's also 2 further documents that we want to release for consultation as well alongside that. So there's an addendum as a guide for governors, which talks quite heavily about system working with some case studies, which will also be released at the same time, and then a guidance of around good governance and collaboration, and what does that mean in practice. So we think those will be helpful documents as organisations move into the world of system working, and I'm sort of pleased to have worked on that over the last year, I guess, to make sure we are consistent with everything we're trying to do with integrated care boards and systems. I think you're going to ask me when it's going to be released. I had really hoped that I would be able to share it with you on screen today. It is imminent. It's just going through some final checks at the moment, and then will be released for consultation, hopefully, very soon, and allowing appropriate responses so we can hear back and adjust as appropriate. I guess that was really what I was going to say, because hopefully we'll get some rich questions, and I'm sure you want to hear from my fellow speakers of how they apply this and the use that they will find it within their own organisations. So without further ado, I shall hand over to you, Paul, so you can give your reflections. Thank you.
Thanks, Miranda. And I'm really conscious that we're, as a panel, sat here today having seen a draft of the document, but the wider conference audience hasn't. I have to say, I now know how the cast of Line of Duty felt when they knew the ending to the series, but the rest of the country was still in eager anticipation. But Miranda, you'll be pleased to know that I don't think, unlike that series finale, I don't think there'll be quite as much disappointment when the new code lands. But what I was going to do is talk in general terms, given the fact that we've yet to see the detail on some of the content, and also cognizant of the fact that some of the colleagues here won't have seen or particularly used the code before. But I just wanted to echo what you said a moment ago, that I think there's a real opportunity for discussion here, and both today around our panel, but also afterwards in the wider sector. And I just put a personal plea as well for everybody to take the time to review that draft code and to give the feedback as part of the consultation process. In general terms, I'm delighted that the code has retained that principle-based approach, and that there's a recognition that the content of the code is best practice advice, and that so non-compliance in itself doesn't indicate a breach of a licence condition, and that departure can be justified. And I like that common sense approach, and I'm really pleased that we've retained that. One of the things we talk about in the NHS quite a lot is every patient being unique and every patient being considered for who they are. And I think every NHS organisation as well has its own personality and style. So I think it's really important that leaders can be authentic in taking the organisation forward. And the code allows us to do that in a way that suits our organisation best. And again, just for completeness, thank you for keeping that comply or explain approach. It's worked across most sectors for a long time, and it does really emphasise the unitary nature of the board. And one of the things that kind of jumped out at me is that even though we're going to be making this an NHS code of governance and it's for all NHS provider organisations, I'm not sure what additional burden that might cause for colleagues in NHS Trust, given the introduction of a new set of approaches. But I think that's an opportunity for us to capture that in the wider feedback. So one of the things that I think when a new code of governance lands is we as company secretaries are probably one of the few groups of people that will be excited about that. But it's important to remember, and I use it excited in inverted commas, but it is important to remember that the code of governance isn't just for us, it's for the whole of the board. And one of the things that I really do like to emphasise when I'm talking about things like the code of governance is that it isn't just a year-end checklist. There is an element of that. So we've just done a report to our audit committee about how we comply with the various bits and pieces of the code. But actually, I tend to see the code of governance as a list of things to do during the year. Doing the right thing isn't always obvious, and it can sometimes be hard to quantify, can't it? As company secretaries, we have a privileged position, and we can sometimes be called upon to be a bit of a sounding board or a bit of the organisational conscience. I think the code really helps us with that, and it helps us to figure out what it is that we need to be doing. I think we need to remember that up until now, we've been used to working as individual organisations, and the introduction in the new code about working out how our individual strategies align with the ICP strategy and talking about alignment of values and culture, I think is really, really, really important. And done properly, that can only enhance the sort of board level discussions that we have within our own organisations. But for me, on a practical level, I think the code of governance helps when I'm thinking about my schedule of board development sessions, about the workshops that we'll be looking at through the year. And also when we're thinking about what our board and our committee agendas should contain. So, for example, where it will say in the Code of Governance there's a requirement to assess individual contributions to the objectives of the ICS, that's ripe for a discussion at a board workshop. And I think that's ripe then for a conversation at board to really show the public and other stakeholders how we are doing that as a member of a wider system. As Miranda alluded earlier, I think the emphasis on culture and the emphasis on diversity just gives that opportunity for boards to really focus in on some of this stuff in their sessions over the coming few years. I really welcome that focus on EDI as well. One of the things that we did at WWL was we took a look at the UK Corporate Governance Code when that was updated back in 2018, and we took the opportunity to develop a board diversity policy then. Now, arguably, we had that in an informal way. We had a process in place, but the development of that policy just made it more explicit. And it's been really useful when we've done our board level recruitment since then, because we've been able to use it in a tangible way. And it's given us an opportunity to kind of check ourselves and make sure that we are addressing all particular issues that we need to think about. And if I'm honest, that came from the UK Corporate Governance Code, but in the same way that it's prompted action within WWL, I think there's bits of the new code that can really help us as provider organisations in different ways. Miranda mentioned a little bit earlier that there is a conversation there's a section in there about remuneration, pay and benefits. And as you would expect, there's a lot of link to stuff that we've already seen. So the VSM pay framework or the framework for off payroll interims. I think if I was being critical, I think one of the things that I would sort of offer as a challenge is it feels like a little bit of an erosion of some of that foundation trust autonomy. And you know, the suggestion that we maybe need to wait for more information or more notifications from NHS England. I understand the concept, but I think the bit that I would sort of feed back, as I can without putting it into the consultation yet, is that's fine in principle, but we do need that guidance to be coming early. Organisations wait for the guidance from the regulator, but actually there comes a point where you need to start making decisions, and you know that if that guidance hasn't been issued, that can become problematic. But I also think the guidance needs to be realistic and reflect the views of organisations as well. So whenever organisations have gone against or chosen to do something different from the guidance from NHSEI, I don't believe they're doing it to make a point. I don't believe they're doing it to be difficult. My sense is because the guidance doesn't chime with what the remuneration committee or that wider system thinks. And I think, you know, there's an inenviable tension, I think, as a regulator, because you've got the wider political things to consider, but you've also got considerations at local level as well. So that would be my plea. But I think just to wrap up before I hand over to Claire, I do welcome the continuation of that code-based approach. I think it's a natural evolution rather than absolute change. And the use of principles rather than prescription is really effective. What that does is it allows for individuality within a wider corporate framework. I do think there'll be areas of detail that we'll want to flag in the consultation. We might get into some of those conversations here today, but I'm sure colleagues around the conference hall will be looking forward to seeing the detail, to getting into it, having a look at it, and then we'll welcome the opportunity to comment through the consultation process. But I'd just like to say thank you for the work that's gone into this from the centre. I know it's not easy, and you know, it is a particularly dry document in places. So, you know, thank you for the work on that. And on behalf of colleagues, I'm sure we're looking forward to sharing more wider feedback when that's out for consultation. But if I pause there, Lois, and hand over to Claire.
Thank you, Paul. And I think really that's just been a really great practical introduction to what it will mean for people on the ground in terms of working with the code going forward. If I might just take a few minutes to introduce myself, because I may be unfamiliar to people that are dialing in and joining us today. I run a company called Charis Consultants Ltd, and we primarily work with boards and executive teams in board and executive team development, particularly focusing on their preparation around well-led and being prepared for well-led inspections for the core inspection with Care Quality Commission. Alongside that training and development arm, I'm also an associate trainer with NHS Providers on their Govern Well programme. So often see at the sharp end some of the tensions that our governance arrangements create for governors on councils of governors, and indeed further than that in their relationship with their board of directors as well. What gives me, I believe, a kind of mandate to be invited to be on the panel, for which I'm very pleased and feel privileged to have been invited, is that I'm also the examiner and course leader for the Chartered Governance Institute's Health Service Governance module. My background is that I did actually qualify as an associate of the Institute of Chartered Secretaries and Administrators, as it was back in the day, and learnt my trade, as it were, in the private commercial sector transferring over into the NHS a number of years ago. So my whole aim really, as being the examiner and course leader for that course, is to make sure that our company secretaries or directors of governance that are coming through to the NHS are well versed in where their source material comes from in terms of the governance principles and practice that they're going to help support their boards with. And so I'm always really pleased that in the area of governance, there is a real appetite for looking outside of the NHS and looking to see what best practice there is across, whether it be the corporate and commercial sector, what's happening in charity governance sector, what's happening for academy schools. And I think in governance, that means that we are able to really benefit from a broad spectrum of understanding of what those governance principles are. So it's really, really, I really appreciate the fact that the new NHS code as it gets introduced is really taking from heart all of the learning that, if you like, the FRC, the Financial Reporting Council, has benefited from in the research it's done in terms of rewriting the UK code for the corporate sector back in 2018. And I would echo what Miranda and Paul have referred to, which is very much, so much of the work on the UK code was done around looking at culture and looking at engagement. It was very much a reaction to all of the scandals around the banking crisis and other major weaknesses and vulnerabilities that were being established in some fairly major companies. So again, really great that we can take the learning from that and bring that into the NHS. I always try with the trainee company secretaries or directors of governance that we have on the course to say, always look at what your source material is, but then really grapple with what does it mean to embed that into the work of the NHS and your work with your particular expression of governance. You might be with an NHS trust, you might be with a foundation trust. Previously, you might have been supporting a governing body on a clinical commissioning group. You may have been providing governance support to a regulator, whether it be NHS England, NHS TDA back in the day, Care Quality Commission. We get a real breadth of people joining us on that course. So the approach that I've taken in terms of contribution for the panel today, I guess, is to almost sit with the two codes side by side and look at what's interesting about what's been included and bits that haven't necessarily been picked up. And I think one of the really challenging things that was in the UK code when it was newly introduced back in 2018 was that absolute commitment to engagement. Now, for the UK corporate sector, that was around really recognising the importance of the workforce, and quite challengingly, and it created quite a few ripples across the corporate sector, was an expectation that the board would possibly even appoint a non-exec director who was from the workforce, so that they had that workforce representation on the board. Or similarly, that they would set up some kind of workforce engagement panel. Now, we don't have the detail of that in the NHS code as it's currently being promoted, but it is really welcoming to see that there is a clear expression within the new code that says the board must actively engage with its workforce. And I think we see that being echoed and picked up elsewhere. The latest work on non-exec director champions talks about a non-exec champion for workforce health and well-being, which is really, really encouraging. In terms of just then helping to also raise the profile of corporate governance within the NHS, it is also really welcoming to see that the code is suggesting that company secretaries or directors of governance, I think sometimes is a term of office that we kind of use interchangeably, and that in itself is probably a good discussion at some point for those of us that are in that field, is to see that that appointment needs to be made by the whole board, and that's a new provision within the new NHS code, which I would wholeheartedly welcome. It puts the role and credibility of the company secretary and director of governance absolutely at the heart of corporate governance for the board. To just then summarise and give those of you who are listening who might have the responsibility of responding to the consultation, I would just encourage you to take a look at some of these particular themes. The code does, as it's currently drafted, again use multiple uses of governance. So it will talk about corporate governance, but it also talks about quality governance. It also talks about clinical governance. And those of you who practice will know that we also have data or information governance. And so I think it's just being really clear in your feedback on the consultation around what do we mean by the particular types of governance that are referenced. I think there is also probably some consultation or some feedback to be given around the interaction between the code and what particularly foundation trusts already have in place. There are places where the principles of the new code may be in direct opposition to aspects of the model core constitution that foundation trusts will have adopted. And I think that may at times cause more tension, and particularly if it's in relationship to the dynamic between the board and the Council of Governance. My experience tells me that greater clarity is helpful, and leaving it for local interpretation will create more tension and more challenge. And just a little bit of personal feedback or comment that I would say is that I would really encourage NHS England to be more directive in the code around its suggestions for the activity of the Council of Governors. What we see in the code is a lot of kind of very clear direction for what boards of directors need to be doing in order to comply with the code, or how to explain otherwise. But much of the wording around the suggestions of best practice for governors is couched as best practice may be, or councils of governors may like to consider. And my experience tells me that councils of governors would respond better to clearer direction and instruction in how they take some of those parts of the code of governance forward. Appreciate that is probably very difficult for those joining us who haven't yet had sight of it, but it may be that in the questions people may like to pick up particular issues that they feel might be helpfully addressed in the code, particularly in that relationship between governors and their boards of directors. But I'll leave it there. Over to you, Lois.
Thank you, Claire, and thank you to all of our contributors. Very helpful discussion already, I'm sure people will have noted. We have a number of questions coming in. We will start with some practical, technical questions, perhaps for Miranda, about consultation. Fiona Barr asks, how long will the consultation be on for, and are there any plans to release anything further about the NHS provider licence? And Pauline Lambert has asked, can you give any idea when the code will emerge for consultation? So perhaps, Miranda, you could answer what you can of that at the moment. Thank you.
Thank you, Lois. So we are planning a consultation period which will allow us to issue in time for the 1st of July. So, you know, a relatively shorter consultation period. I think it was around 6 weeks. Obviously, that means I need to get it out ASAP, but I think it will be helpful for it to be in place for the 1st of July. The provider licence we are looking at was a slightly later time frame that would be going out for consultation in quarter 3. And just the final question, can I just have I answered the final question? Was it when will the consultation come out, or because so that will be late as soon as I practically can get it out from doing my final checks, then a 5 to 6 weeks consultation with the aim to get the code released in time for the 1st of July. So hopefully I have addressed the questions that have come forward, but raise them again if I haven't quite answered your questions.
So we all need to be poised for leaping into action and responding very promptly in the next 2 or 3 weeks, maybe. We have a number of other questions on some quite various themes, so we may be jumping around a little bit, but I will try to group them together. One interesting point that's been raised is why the code applies only to provider organisations and not all NHS bodies, including, for example, NHS IE or the ICS, particularly as it's principles based. and has an opportunity being lost? Claire, I know that's something that you were thinking about earlier on as well, so I wonder whether you wanted to expand on that, and perhaps we can give some thoughts collectively.
I think it's an absolutely pertinent question. As part of my work training up company secretaries and directors of governance, as I say, we're trying to provide a course that provides that underpinning of source guidance, whatever part of the NHS that you're working in. And I think there is an opportunity there for us to think about how this code might evolve and therefore become applicable, whether it might be by adoption. You know, I know if I had 3 directors of governance on the next training course that are all supporting ICS boards, I'll be saying, okay, well, let's go back to the first principles of the code for the provider trusts. That's good practice. How do we think about actually embedding them in the principles that you need to approach? And I think the underpinning commitment that is within the code, which is around aligning with system thinking and collaboration, would make it not that difficult to then apply across. Miranda, I guess at the heart of it, may have some more insight. It may just be a question of there is such a lot of guidance to come out, and this was perhaps probably the piece that was most overdue. I think the framework that we have for the integrated systems for the boards and the partnerships does begin to address some of these things, but certainly in practice I would be looking at this code and going, so how do we embed the principles from this across ways?
Thank you, Claire, very helpful. Does anybody else want to come in on that point? No? Okay. Sorry, Miranda, do go ahead.
No, I think it's a fair challenge that I need. I will think through. I mean, I think some of it was, the passage of time. We knew we needed to update the code. We're expanding it out to foundation trust. But I agree, the principles of good governance and how this should apply should be more general. So I think I'll need to reflect on that and think through how we continue to adapt our guidance as we move forward into system working. But I think it's a fair challenge to put to me.
Miranda, if it helps, there are times when I'm doing some of my training courses, and because so many board meetings are now live streamed or available live, we do sometimes look at some of the regulators' board meetings that are in the public domain. So we're looking for evidence of good practice there as well. So again, across the course, we're trying to be as inclusive as we can across the whole of the NHS landscape. So anything you could do there would be helpful.
Thank you, very helpful, very good and responsive of NHS EI to say that they'll take that into account. So thank you very much, Miranda, very open and responsive. Pauline Lambert asked, what are the common tensions that we might encounter in implementing the new code? Paul, do you want to start us off on that one?
Yeah, of course I will. And I think if we talk at 2 different types of tension, I think there's an internal tension sometimes, and there's an external tension. Tension's an interesting word because I think it quite often has negative connotations, but we all know, I think, that tension can in itself be positive if it's channeled in the right way. But I think one of the areas of internal tension quite often, and I say this based on the best part of 10 years working with organisations pre-COVID. I'd go around the country and deliver presentations, facilitate workshops, and I think at every single one of those, without exception, there was a description of some form of tension between the board and the council of governors, and that's not a personality-based tension. That's not a reflection on individuals. I think what that's reflective of is the fact that the role of the governor is quite loosely defined on a day-to-day basis. So they've got some very clear duties, they've got some very clear responsibilities. But how often do we receive the annual reports and accounts? The name clues in the title is once a year. How often are they appointing a chair and non-executive directors? The list goes on. So I think those very clear, specific responsibilities of the Council of Governors are ad hoc. They happen from time to time. And I think the more general duties, the representing the interests of members and the public, and the holding the non-exec directors to account for the performance of the board, they are subject to interpretation. And I think what we've got is a situation where different organisations and different sets of individuals interpret that and do that in a different way. So if that's where we've been, certainly for the last sort of 8 to 10 years whilst I've been on my travels doing those sessions, and when we escalate that and we take that more to a system-wide approach, I think that can only have a potential to be a little bit more challenging. That said, I do note that there's some guidance that's currently under review from NHS England, and hopefully that will try and pick up some of that, give us some examples of what that might mean. The external tension, I think, is the tension between provider organisations and the centre. And by the centre, I mean the regulator, but if we use a general term, because it's not always the same. And I think some of that is a little bit what I alluded to earlier about guidance coming out a little bit later than hoped, or that guidance not necessarily chiming with the expectations of the local people. And I think that's, if we can have an open dialogue about that, if we can start feeding into that, then hopefully over time we can start to address that. But I see those as the two main areas of tension, but I'm happy to see if others have any others they want to throw into the mix.
Perhaps I could ask a related question that's been posed by Krishni Waring before perhaps asking Claire to chip in on the subject again. Krishni writes, it's good to know that there is an emphasis on diversity, wellbeing and culture within the new code. I'm interested to know more about how the code will help FTs to ease some of the tensions between governors and boards that seem inherent in the way that the roles have been defined. Tensions are fine if they are productive and help us to make better decisions, but too much of the historical guidance has caused lines to be blurred. So when you're responding on the original tensions question, perhaps you could reflect some of what Krishni has said there, Claire. Thank you.
Thanks, Lois. So if I just go back to the tensions, and I think I perhaps alluded to a little bit of that in some of my introductory words. So I think there are some tensions around clarity on what do we mean by governance. My understanding, and I guess my position would be, this is a code of corporate governance. That has to be a fundamental responsibility of the board. Quality governance, clinical governance, information governance, any of the other governances that exist within our organisations serve the purpose of the overarching governing responsibilities of the board. So I think there is a tension around what actually is the board being required to focus on. Is it ultimately going to be allowed to focus on corporate governance and those other governances be the enablers? So I think there's a bit of a tension there. I think there's a bit of a tension around, and again, without wanting to just focus on foundation trusts, but if I start with foundation trusts, it's very clear in the legislation that the board's statutory duty is to promote the success of the corporation for the benefit of members and the wider public. And now we have within the code that the aim of the board is the triple aim of better health and well-being, better quality health services and sustainable use of NHS resources. So I can, with some flexibility, go, well, actually that triple aim enables me to deliver that statutory duty. Is that putting flesh on the bones, or actually are we moving away from that statutory definition that foundation trusts operate under? Similarly, there are very clear statutory duties for the boards of NHS trusts within legislation. So again, are we reinterpreting those to mean the triple aim? And then we've added in reducing health inequalities. And then we've added in a duty to collaborate and to align with the system. And I think there is a tension of, so how do we prioritize as a board? What does corporate governance mean? Are these all tools to help us govern, corporately govern well, or are they things that are going to overtake that corporate governance? So I think there's a bit of a tension there. I think the other tension is around, and I guess, this is an FT focus, again, is that there are aspects of the code which will, again, restrict or reduce the FT freedoms that were originally established in the legislation. So we've already had the introduction of kind of pay frames for chairs and non-executive directors of foundation trusts. Understandably, why that was what that was brought in, but there are also changes in the code that will have other implications for foundation trusts. What I do welcome, though, is the attempt of the code to address the tension between the boards and council of governors. And I hope, Miranda, given that it is coming out, I think this bit's unlikely to be changed. There is clarity there that in extreme circumstances, NHS England themselves may interact where councils of governors are actually impeding boards of directors from delivering under their provider licence. So I don't know if Miranda particularly wants to comment on some of the work that's been done there to address that particular tension.
Thank you. So I do think the addendum FT guide to FT governance will be important here, because I think this is around engaging and explaining more about how you can reconcile responsibilities to the broader system as well as being the governor on the FT board. And, you know, this is all about patient citizens within the system, and this individual may well be a patient of your organisation, but also another organisation within your system. So I think that we're working hard to work on the guide for governors. I do recognise the tension when I go around. I was recently at an event and speaking to some chief executives. I do recognise this is quite a challenge. So I'm hopeful that both what we've said in the code, but also what we're going to put into the addendum for governors is going to be helpful. And I think there is something around engagement and explaining what we're trying to achieve here. So I do think that is important. I think governors can play a really good role, but I think, you know, I do recognise that it can also sometimes be challenging to navigate your way through. And I do think system working makes things more complicated. And I think you mentioned, you know, how do you reconcile good corporate governance with also all the other duties? But I think there is a way to reconcile. It's just like I just think the way the world is working, we're not going to have. You have to work in partnership. You have to be able to make collective decisions to do the best for your, not only your shareholders but your stakeholders. So, you know, when you look at the Companies Act, I think you can reconcile that working in the interests and taking consideration of customers and stakeholders can reconcile to system working. But I think it's not without its efforts in terms of building relationships and trust and common goals of what we're trying to achieve.
I would completely agree, Amanda. And I think if you can see that having assurance processes in place so that as a board you're clear on your clinical governance or you're clear on your financial governance, that enables you to take that overarching position on corporate governance. I think it's important for boards to be able to kind of make sure they sit at that leadership level, so they're able to do that and not get kind of too involved. I think it's an impossible task, if I'm honest. I don't know what my colleagues think. We have a council of governors that have a duty to represent the views of members and the public, and some of the transformational work may not sit well locally in some places, and so the council absolutely is fulfilling its role in doing that. But then to be told that their statutory duty is to check that there's been due diligence, and due diligence may still proceed down a particular course of action that they feel locally doesn't sit well, does put the Council of Governors in a particularly challenging position when it's the right thing for the system. So I think it's going to take some real skillful negotiation as we move forward through some of those situations.
Thank you, everybody. I'm very aware that our time is rapidly passing, so I will try to wrap a number of our shorter questions in together. David Gordon, hello David, has asked whether there'll be a separate code for integrated care boards, or is the intention that they will be largely autonomous in developing their own arrangements with system providers. I think Miranda's committed to having a bit of a think about that and how we need to make sure that the key principles that have been highlighted as so important for provider trusts are rolled out to other organisations. We've also had a question in from Catherine Afalabi about whether NHS Providers will be updating its associated documentation and guidance, particularly those for governors. And in line with the new Act. And we've had confirmation from our colleagues at NHS Providers that absolutely, yes, they will be, and they're looking forward to doing it. But one thing that I would like to ask, as well as David Leigh, who has posed the question, is whether any impact assessment has been carried out to determine whether there will be an additional burden on trusts as a result of the new Code of Governance. That's probably a very technical question for Miranda to answer, whether that's yet been factored into the development of the new code, but I don't know whether Claire or Paul might want to comment afterwards on whether they perceive that it's likely to be a significant change in impact.
Sorry, was that a question to me, Lois, about the impacts? So I don't think it has been factored in currently, but I need to double check with my team, so I do apologise on that one. My assessment would be, I said at the beginning, there's not a fundamental change to the way the code is operating. So my expectation, it would not, I recognise the amount of, we need to be really careful on the amount of burden we're putting on organisations, given everything we're doing around system working. So that is very much forefront of my mind. But having looked at it, I don't consider it would have a significant impact, but I will have to go back and check with my team. I do apologise that I can't definitively answer that question.
Don't worry, and there's still the consultation period yet, so plenty to do. Paul, do you think it's going to have beneficial impact? We're always worried that it's going to be a regulatory burden, but actually having a really good set of documents can sometimes be really helpful.
Yeah, let me just pick up a little bit of the kind of the essence of the question, and then yeah, I'd love to talk about the positive as well. So I think there's a natural nervousness, isn't there, when anything new comes in about how much extra work is this going to create. I suppose the answer that I want to give is this is about changing how the board and the organisation thinks and potentially acts in some sets of circumstances. So this is more about culture. That word's come up again. It's more about style. So whilst I recognise that there might be a little bit of a different way of reporting and doing things from a company secretary perspective or from that kind of comply or explain approach, I actually think organisationally we should be able to take this forwards. But I do recognise that for organisations that have never had it, it might feel and in some cases seem to be a bit burdensome. I just wanted to talk about the emphasis on workforce within the code, and I know it's really easy for us to do that because we've seen the draft, but I think it's great that there is an emphasis on workforce. And as a sector, one of our biggest issues, one of our biggest risks is workforce. That's informed by culture, that's informed by lots of different things, but I think there's a really positive impact of having that focus on workforce within the code of governance, because what that does is it makes boards raise their vision even further. And I don't believe there's a board in the country that hasn't got workforce on its radar, but I think it just channels those conversations. And I think that can only be positive. I think going forwards with that additional focus and with some of the stuff that we're looking to do sector-wide around workforce, that in itself can only be positive. And I just wanted to balance the potential negative burdens with a little bit of positive as well.
Thank you very much. Claire, did you want to come in on that point?
It was just briefly to say that all my fellow company secretaries or directors of governance out there, yes, if you're in an NHS trust, you've not necessarily had to read the FT Code of Governance, but I'm guessing if you got posed with a particular situation and you needed some guidance, you'd have had a quick read of it to see what was best practice. So I'm really optimistic that the principles of good governance that are expressed in the code are already largely embedded in our NHS provider organisations, regardless of constitutional form. This merely codifies it and gives you an opportunity. If something is uniquely different for you, you get the opportunity to explain why. So I can't, the impact assessment is perhaps unclear, but having had a chance to read it, I don't see that it's huge.
Thank you. I'm sure people will take great comfort from that. And indeed, those of us who are in NHS trusts, even if we've been in FTs in the past, will be reminded what a gripping read it can be, but actually really helpful, really helpful. Sometimes it's just good to have it all set out in one place. So we have come to the end of our conference session. There's a number of other questions been posed that I'm afraid we haven't had the opportunity to consider, but a lot of them are very technical questions about what is in the code or might not be in the code, and they look like ideal questions for people to be feeding back during the consultation. So please don't forget what you've asked, make a quick note of them and use them in the consultation period. I'd like to thank our panel members, Claire, Paul and Miranda. It's been hugely helpful to have three different, slightly different in some cases, perspectives on the new code. I commend the new code, the draft code, to you all when it comes out, because it has such a great potential to be helpful and to be clear, and we need to work collaboratively as a community of governance enthusiasts to make sure that it's what we all need it to be and what it all could do for all of us. So thank you very much to everybody who has participated in whatever form in this meeting, and thank you very much for joining in.